I 100% believe that you should have informed consent and medical autonomy. And if you don't believe in those two things, this podcast episode is probably not for you. In fact, the Health with Hashimoto's entire platform is probably not for you. I want you to be the CEO of your own health. I want you to make the ultimate decisions. Your medical team is on your team, but they don't call the shots. You do. And that's what we're talking about today. If you are on my email list, you already got a little preview because I sent out a very spicy email on Saturday. If you're not on the list, head over to my website, healthwithhashimotos.com. And I do now have a little teeny tiny pop-up that's easy to X out of that will help you sign up for my list. Welcome to the Health with Hashimoto's podcast. This is where you will find clarity and simple, sustainable strategies to feel better. I want to help you figure out your root causes. My name is Esther Youngkin. I am a registered nurse. I spent about 17 years in the emergency department, and then I got sick and tired of putting Band-Aids on chronic things. I went back to school, and now I have been in holistic health education for about 10 years. I know how exhausting it is to live with fatigue, brain fog, and the ups and downs of Hashimoto's. And that is why I'm here. I'm here to cut through the confusion and to give you practical steps that support your body, calm your immune system, so that you can regain your energy and feel like yourself again. Informed consent and medical autonomy is not something that we used to talk about. Even as a nurse, I did not really talk about it because it was assumed that that is the job of your healthcare providers, your doctors, your nurses, your nurse practitioners, everybody on your team. They are supposed to give you informed consent for everything you do. It was taught to us in school. It was practiced in clinicals. It was applied on the job. That's just part of being on the medical team, is providing patients and clients with informed consent. And that means enough information to decide yes or no, the pros outweigh the cons and I am going to move forward, or the cons outweigh the pros and I am going to not move forward. I'm going to go in a different direction. That is the job of your medical team. It is to give you enough information that you can make informed consent. And it didn't used to be controversial. Why is it now? I have no idea. If you can tell me beyond politics, if you could tell me why informed consent is controversial, I would love to know, because I have not heard a single reason that I accept as valid. I'm sure people have told me why. And we're going to talk about that. And I want to preface this by saying I have so many friends in the medical world. I don't dislike any of them. I have worked with good doctors, good nurse practitioners, bad nurse practitioners, good nurses, bad nurses. And when I say bad, some of them, actually, I've worked with at least one doctor where I wouldn't send anybody to see that doctor. She was truly bad. I worried for my patients. All of the nurses had to be on our best game to make sure that everything was okay. So I have worked with bad doctors. I have also worked with people who had differences of opinions. I have also worked with people on the medical team who I felt like they didn't know what they were talking about, or they just didn't know much at all, enough to get the job done. But I wouldn't ask them any questions. On the other side, I have worked with so many, way, way, way more people that are absolutely incredible. They have a heart and a passion to help the person in front of them, whether that is a paying patient or client, or just a friend or a neighbor, or just acquaintance. I have worked with so many people. The vast majority of people I have worked with in medicine are good people. They want the best for people. And when I say this next thing, it applies to some of those people. And here is my controversial statement. And I came to this realization actually after the acetaminophen Health and Human Services, RFK, Jay, and Trump, press conference. I'm going to get to my controversial statement in a second. So I know a lot about the antioxidants that your body makes. I know that your body can make antioxidants, things that your body can make naturally. That's called endogenous. You make it from the inside. It's ENDO, endogenous. So your body creates antioxidants. We've talked about that actually quite a bit on the Health with Hashimoto's podcast. I recommend 2 specific products. It's called the Life Vantage Protandim Dual Synergizer because one of them helps your body make more antioxidants, including glutathione. It helps your body make 300% more. And that's native endogenous glutathione, which of course, if your body is making it, your body can use it better. Glutathione that you get through an IV or oral formulation or anything else is not very bioavailable. It is hard for your body to take. So the LifeVantage Dual Synergizer, one of them helps your body create more glutathione and other endogenous antioxidants. The other part of it helps your mitochondria create more energy, more ATP. And I recommend those two things for everybody with Hashimoto's because we need both of those things. And also, I recommend them to pretty much everybody who asks me for health information because so many things start out at the cellular level, and we need to clean up the cells and we need to provide the cells with energy, with what they need. So I have been learning about this stuff for over 15 years. Maybe closer to 20, I first learned about endogenous antioxidants. My now 14-year-old son was diagnosed with lead poisoning at his 1-year well child check. We lived in a really old house, but as a result of that diagnosis, I had to dig into the liver and how to help his body detox. At 1 year old, you cannot do a lot of the things that you can do for adults because he's just too little. I was told we can do a little bit, but you're going to have to wait until he's a teenager, and then you might have to go out of the country to get the best treatment because the U.S. doesn't provide it. Well, I'm like, no, absolutely not. I do not accept that diagnosis and that plan for my 1-year-old. So I dug into the research. I did everything I can to learn about the liver and how we can help it. So I have been learning about detox, liver, glutathione even more since my 14-year-old was 1 year old. Okay, so with all of that background, I know that acetaminophen, Tylenol, impacts the liver and it decreases glutathione. I also know how important glutathione is for your overall detox because glutathione acts as like a sticky flypaper. So, a sticky flypaper, we hang it in our kitchen in the summer because I live out in the country. We have chickens, we're surrounded by farms, and we get flies. And so the sticky flypaper has a smell that humans can't smell, but the flies can. So they land on it, stick to it, and then they're not flying around our kitchen. Same thing happens in your body. It's like sticky flypaper for the toxins. That's glutathione. The toxins stick to it. The glutathione helps take them out of the body. We want it. We need it. And in our world, we are more and more and more bombarded with environmental toxins. So it makes 100% sense to me, with all that I have learned, that when you have acetaminophen, it impacts your glutathione. And then when you're exposed to environmental toxins, your body can't deal with them very well, and so they cause more damage. That just makes sense. And so even before I read all of the studies, I already knew that because I have been reading studies for the last 15 to 20 years about this. And I already knew that Tylenol was controversial because of this and because of other things. So I went on Facebook and Instagram and I recorded a couple stories and a couple videos, just very, very short, saying acetaminophen impacts your glutathione. Here's what you can do. I didn't think it was controversial at all. Well, interestingly enough, I have had 2 different sets of people reach out to me. One set of people thanking me. These, interestingly enough, mostly nurses. Even like a phone call. Thank you for speaking out. Thank you for sharing your research. I trust what you have read and you're speaking the truth. These are the messages that I'm getting from nurses. And then it blowing my mind, it's maybe not every single, the majority of messages that I have received telling me to stop, telling me that I am spreading medical misinformation, those are all from doctors, majority from doctors. And these are doctors on Facebook and on Instagram. I believe every single one I have worked with personally. And like I said at the beginning of the episode, friends, good people. They want the best for their clients and for their patients and for their coworkers. So it got me thinking, why are the nurses thanking me? Again, broad generalization. Why are the nurses thanking me and why are the doctors telling me to stop? It was kind of discombobulating actually, because I am just speaking research. I am just speaking what I know, what I have read about, and I don't go on hype. I don't go on politics. I want the best for you, for my listener. I want the best for every single person who does anything on my platform, on the Health with Hashimoto's podcast. My goal is that you have informed consent. You know the pros and the cons, and you can do the best thing for your situation at that current time. That is my ultimate goal, that you can make those decisions so that you can feel better, so you can feel like yourself again. So when I started getting these messages, I was a little weirded out, quite honestly, because I haven't said anything that is misinformation. Everything that I said was based in fact. Now, here is another fact. There are multiple studies, many, many studies about acetaminophen, and some of them show that babies born to women who have had Tylenol, who have taken Tylenol, they have an increased risk of neurodevelopmental problems like autism. But the thing is, you might have heard about the study that was led by one of the top people at Harvard Public Health. They did that study because of all of those studies. There are some of those studies that show that no big deal. Other studies show it's a big deal. So the Harvard study, I'm just going to call it the Harvard study, and I will have the link down in the show notes if you want to read the study for yourself. They looked at 46 different studies and they rated them. They took just data, right? They took the emotions out and they said, here is our criteria. We're going to figure out which ones were good studies and what the good studies found. We're going to rate each one and we're going to figure out, what do all the studies say? Because most of the people who talk about Tylenol and say it's totally fine will point back to those studies and they'll say there was a lot of studies and some of the studies show that it's no big deal. And other people who are saying, actually, Tylenol, acetaminophen can be a big deal. Let's let women know so they can make an informed decision. Maybe they're not worried about it. Maybe they are. But the woman themselves needs to make that decision. And the people who are saying that, they're looking at the studies and saying there were studies that showed that there is a risk. And of course, you can hear my perspective on this. I feel like you need to have the information and you need to make that decision by yourself. Not maybe by yourself, informed by your trusted medical team. And so as I'm thinking about this, and as I'm thinking about the doctors who have told me, Esther, stop talking about medical misinformation, I also started thinking back, was it 2 months ago, when somebody in the government, I don't remember who, probably the FDA or the drug people, they have decided to stop natural thyroid medication. So natural desiccated thyroid, which is actually a thyroid gland that is, dried powdered. If you're on Armour thyroid or if you're on a compounded one, those are the most common ones, then that is the natural one. And those are going to go off the market. There's, controversy. But I started thinking about that. And I started thinking about this Tylenol thing. And what do the two have in common? I believe, and this is where I made some people mad, I believe that this is a hangover from the days when doctors were treated like gods. Back in the day, and I'm talking, maybe 50s, 60s, 70s. I don't think the 80s, but I'm not sure. I have worked with nurses who experienced this. When a doctor walked into the room, everybody else had to stand up. The nurses had to stand up in respect for the doctor who just walked into the room. When I say that doctors were treated like gods, I mean that people stood up when they entered the room. I mean that when they spoke, they assumed that the patients would just do what they said, no matter what. And they would not ask questions. They would not argue. They would not read research and figure out their own opinions. What the doctor said was like gold. It was treated like God said it. And most doctors, I have worked with a couple who still have that complex, but most doctors do not believe that anymore. However, I believe that they are still trained a little bit that way. And they believe that their word, their research, their learning, their institutes of medicine, their, associations and stuff carry more weight than yours. And there's nuance to this. I 100% believe that education is to be valued and it does carry weight. And then you can get into the weeds of, what is their education like? And so I do believe that doctors have been trained and they do know some stuff. But I also know that in today's age, the average person can learn to learn. You can learn to read the research. You can learn to put things together. You can learn to read, 10 different studies and figure out where are the commonalities. You can learn to look for the pros and cons. You can learn to learn. And that is not restricted to, you can only learn about medical stuff if you went to medical school. And of course, you know that because you are listening to the Health with Hashimoto's podcast. You know that you can learn to learn. You have learned to learn, or maybe you are learning. And you can listen to people like me who have already learned to learn. Okay, personally, my story, I went to nursing school for 4 years. I was a nurse for a lot of years, went back to school for holistic health education. It was a program for nurses. When I went back to that program, each little course or module that we had, they gave us a packet of information. This was 100% research. They pulled a whole bunch of research studies, and I had to read through that entire packet. It was, oh goodness, I want to say like 200 pages long. In some of them, it was ridiculous. Kind of frustrating at the time. And after I read through all of those research things, then I had to write like a patient education plan. What would I say to a patient or a client? And not only did I have to read, all of the research and put it together, but I had to look at it through a lens of a whole person: body, mind, spirit, diet, environment. And I had to make it simple for my client or, my instructor to read and learn. And so that was my training. And I know that the average person can learn to learn. You do not have to go to medical school to learn about medical information. We have PubMed. We have Google Scholar. Both of those have published medical research. We have Substack. We have blogs. We have YouTube. We have podcasts. We have so many things where you can learn and you can get information. And it's not gate-kept anymore. I believe that this acetaminophen thing and the thyroid thing both stem from the doctors and the doctors' associations thinking that they know better than you. And they want to say, well, I have read the information and I have made my decision. Therefore, I am going to tell this to all of my patients and they don't need to know anything else. That's not the world we live in anymore. You have medical autonomy. You make the final call. Your doctor, your other medical people, they are on your board of directors. They are there to advise you and to give you the best direction that they can. That's where I am. I hopefully am on your team. Through the podcast, through the resources in the Health with Hashimoto's community over on school.com, SKOOL, not SCHOOL. Maybe you have gone through the program, the Holistic Hashimoto's program. Oh, by the way, that will be changing. I am redoing it. So if you have considered doing any of my things that I sell or have, do it before Black Friday because everything's going to be changing then. So if you thought about jumping in, do it ASAP. I'm just going to tell you, the week of Black Friday, you'll want to be on my email list so that you get all of the info. I have been working on that all week, and I've got some exciting things for you. But if you've thought about doing the Holistic Hashimoto's program or anything, do it now or wait until Black Friday and see what I've got in store for you. Anyway, what was I talking about? Oh, I hope that I am on your medical team. I hope that I am helping you make the very best decisions. I hope that I am helping you have informed consent, know the pros and the cons, be able to make the best decision for yourself. So I would love to hear your opinions on this. Do you think I'm way off base? Do you think I'm right? Do you think that there's something to this? Like I said, I love my doctor friends. I have a lot of friends who are doctors and they have the best heart. But were they trained to believe that their research and what they have read and what they have decided carries more weight than what you have read? How are they trained? Are they indoctrinated to believe that their beliefs and their opinions supersede yours? And I hope that's not the case. Maybe there's another explanation, but like I said, I haven't heard one yet. But maybe there is. But mostly, I want you to have informed consent. I want you to be able to make the best decisions for you. I want you to have medical autonomy. And I want you to figure out exactly what you need to do to feel like yourself again. I'll see you next week on the Health with Hashimoto's podcast. And oh, by the way, I forgot to mention like my stance on all of this. Like put it all together and where do I fall? Acetaminophen. I will take Tylenol if I have a migraine and nothing else is working. However, I will always take an extra Protandim NRF2 so that I increase my glutathione to compensate. I don't know if it, 100% compensates, but in summary, I take acetaminophen as little as possible. And I increase my glutathione in response. When I was pregnant 5 times, 1 miscarriage, I did not know about the risks of acetaminophen, and I'm sure I took it just like most people. I took it when I had aches and pains because I was told that it was safe in pregnancy. As far as thyroid medication, natural thyroid medication, there's about 10 to 20% of people with hypothyroid problems, not necessarily Hashimoto's, but including Hashimoto's, and they do not respond well to traditional pharmaceutical medication for thyroid. They respond best, their symptoms respond best to natural thyroid medication. And so I believe that they should have medical autonomy. They should be able to access what they know works for them. They've already tried the synthetics, the pharmaceuticals, and it doesn't work for them. It's about 10 to 20% of people with thyroid issues. And so I hope that the government gets all of that worked out so that people can still access their meds. And that is where I stand on those 2 issues. But I always come down to informed consent and medical autonomy. This podcast is for informational and educational purposes only. Please discuss any changes with your trusted healthcare provider. To take your next step, join our school community and explore the courses available there. You do not have to figure your health out alone. So that is school, SKOOL.com, and it is the Health with Hashimoto's community. I'll see you next time on the Health with Hashimoto's podcast.